Hello and welcome to How to Survive Healthcare. I am Kayla Thompson-Riviere. I have over a decade of experience as an RN in the ER and ICU. Now I'm helping people as a dedicated advocate.
And I'm Nicole Broadhurst, a healthcare billing specialist and financial advocate, here to make sure you're not paying more than you owe.
We're here to share the insider tips and tricks you need to navigate the healthcare system, avoid common pitfalls, and get the care you deserve.
Because no one should feel lost or overwhelmed when it comes to their health.
Now, it is important to note that the information we share on this podcast is based on our experience and research, but it's not intended to replace professional medical advice. But whether you're a patient or a caregiver, you're in the right place. Hello, and welcome back to the podcast. Good morning, Nicole. So good to see you.
Good morning, Kayla. It's good to see you. I'm excited for this week. I'm excited for this conversation.
Me too. It is going to be Thanksgiving this week. Thanksgiving is my favorite holiday. Not specifically because of turkey and pumpkin pie, although pumpkin pie is okay. But I love the true essence and spirit of Thanksgiving, the time to pause and reflect and have gratitude and be around family and friends who mean the most to me. And I just love it. And also food is great. Especially if you've got ham, mac and cheese, and homemade green bean casserole, not that canned stuff. I am there.
Love it. Comfort food is the best.
Yes, but for a lot of people this week, they're going to be traveling to see family that perhaps they haven't seen in several months or maybe since the holidays last year. And unfortunately, a lot of Americans check in on their older family members this week and find that their living situation and overall health wasn't where it was left last time they saw them. So today, if we want to cover, if you're finding yourself in that situation, kind of the things to look out for to see if your loved one needs more support and some guidance on what to do next. Nicole, is this a situation that you've ever found yourself in?
Kayla, I love that we're talking about this because honestly, I wish that there had been a podcast or a conversation around this topic 10 years ago. When I was going through this, when my family was going through this with my grandmother, and we had moved away. And so we only saw her periodically through the year. And this is absolutely what we found to be true, is that you come in and all of a sudden things are not the same. And there are so many aspects around that situation when you walk into it and find it. I'm really excited for us to talk about this stuff so that people can have these resources and have a better idea of how to manage through that, what some tips and tricks are. So yeah, it's a real thing, right?
Yeah. And absolutely to what you were saying, of course, for those listening who maybe aren't familiar, that's the whole goal of the podcast here, is to really share information with all aspects of the healthcare system that, they don't put on the flyers and give you at your doctor's appointments. And they don't really tell you in school, what do you do when you go visit mom and grandma and it looks like you don't know when the last time they showered. That can be a very difficult situation to navigate. So I just want to start off by first identifying some of the red flags or warning signs that perhaps your loved one does need a little bit more support, either in the home or perhaps even looking at if the home is the right place for them. So we're going to divide it into a few categories here. And this is by all means not an inclusive list, but hopefully just to start giving you some ideas for the type of things to look out for. So first and foremost, we want to be looking at their physical health and mobility and seeing if there's any concerns there, such as a big weight loss or weight gain. If our loved one is having difficulty with balance or struggling with the stairs, or perhaps getting in and out of the tub or shower or bed, if they mention anything about that. You also want to look for if they're having falls or do they have a lot of bruises. Some things can cause people to be more susceptible to bruising, like blood thinners. So it's by all means not a an absolute issue, but again, these are just things we're looking out for. Additionally, look if they're having some sort of struggle or difficulty with their activities of daily living. So these are things like bathing themselves, dressing themselves, keeping themselves groomed, maybe getting to the bathroom. And then also, of course, the general upkeep of the house. Everybody's house gets messy sometimes, but is the garbage piling up in the garage? Is there mold growing on dishes in the sink? Those would be some more significant concerns in that arena.
Right. Oh, so true, Kayla. True, true, true. Specifically as we talk about those physical things, I'm thinking about my personal experience with my grandma. And one of the areas that we noticed initially, even before some of these physical things started happening, were really more in the realm of the cognitive and the mental health
Mm,
changes we started to see. Um, for her, it was a lot of memory issues, like not just the random, forgetfulness, but things like she wasn't calling people by name as frequently anymore. She wasn't remembering special events, or, like I didn't hear from her about birthdays or those types of things. And so that's kind of where we saw some of that confusion happening. And
mm,
specifically for us, around the holidays, there's lots of traditions. Families have lots of traditions, and ours is no exception. And so I think for us, it was like the first Christmas and the first holiday season where she wasn't remembering some of those traditions,
oh,
right? Like she wasn't participating in them or preparing for them the way that she had for 50 years, which started to kind of give us the signal that that's really not like her, what's happening.
right, right.
So memory issues around forgetfulness, more than just random, I forgot where I put my keys, more things like not necessarily calling people by name like they used to, or her routines were not the same as they had been for any particular reason, like she couldn't verbalize, you know and like I said, rituals, or what did I call them? Traditions.
Hmm.
She wasn't upholding those, and it was just kind of out of the ordinary. And then the other thing I wanted to share specifically around this cognitive mental health issue is we started to see more a little bit more anger, and more sudden mood swings for her. And I think that it occurred because my experience with this, with forgetfulness and that type of thing, these changes, is that she recognized that she was having some of these issues.
Right, right.
And so I think she was trying to mask some of that. And so when we would ask her a question that seemed easy, like about these traditions, we might say something like, "Oh, Grandma, what about the pickle for the tree?" Right? Or whatever this
Hmm.
is. And she would get angry at us for asking the question. And it was
Hmm.
her way of, I think. So I think those are the three things that, one, we noticed and I think are pretty common in regards
Hmm.
to some of these things to look for when we talk about signs to watch for.
Sure, sure. And just on the topic of cognitive and mental health and specifically memory concerns, just want to let you guys know I did do an episode a little while back about, is it forgetfulness or could it be dementia? So if you are noticing some of these signs with your family member and want to explore that a little more, I recommend going back to that episode. Um, so, also on that note, though, and I had mentioned a few minutes ago about the dishes and trash, the home environment can give us a lot of clues as to how well somebody is doing in that environment. Um, in addition to the dishes, there's other things look at the bills. A
Mm,
lot of people in this this generation and age bracket that we're talking about still do paper bills. So are they piling up on the counter? Are you seeing notices that payment hasn't been received, or perhaps it got returned? Medications. This is a huge one.
mm,
Are are they taking them? Or look at the bottles. Are the bottles, the refill dates? For example, most pill bottles you get like a 30-day supply. Well, if it's something that they're supposed to take every day and there was 30 pills in the bottle and the fill date on it is from 4 months ago, they're not taking that medication nearly as often as they're supposed to. So look at that. Look for expired medications in the home, or do they have a system in place at all? If they just have like a random grocery bag full of pill bottles, I would literally bet money that they're not taking their medications appropriately, because that's just I would struggle with that. They
right.
need some sort of an organizer or a punch system, the prepackaged ones, something. If you've got more than 5 meds, you're just asking for a med error without some sort of a device. Um, Also, make sure you're looking out for things that could be hazards in their environment. Do they have
Mm,
throw rugs that they could trip over? Is there a soft spot in the floor? Is there spoiled food in the fridge? These are just, again, some things that maybe being in the home environment by themselves isn't working anymore. And of course, once again, people want to stay in their homes. I'm one of those people. I joke I want to die in my house. But we have to make sure that it's with safety and dignity. Nicole, did you have some of these issues with your grandmother?
So it's really interesting. My grandmother, it's quite frankly, was a little bit messy anyway. And so I think that some of these home clues that we're talking about here were a little bit down the road before they got noticeable for us. However, I think that disorganization, you talked about the bills. I will say this, one of the things that like literally just came to my mind was, I don't even know if I recognized it when it happened, but she got very confused about dental appointments. Like I felt like my
Huh.
grandma was going to the dentist a lot. And and I think what it was is that she was missing the appointments
Oh, yeah.
and rescheduling. And literally that's something that just popped up in this conversation. I was like, "Oh, I didn't recognize it at the time." But that was, I think, she was missing the appointments and rescheduling them. And then that's why it felt like she was going to me a lot. Well, didn't you just go? No, 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 I'm going now. And so anyway, it was those kinds of conversations. So the cluttered living space and messy, that like I said, that took longer for it to become a noticeable issue for us
Sure.
as a family. So but one of the things that we did notice was really around some of the social situations. My grandmother was um, actually she was president of the local welcome wagon, and so I share that to say she was super social, like lots of friends, lots of activities in the community, lots of things going on. And so along with some of these other memory things that we noticed, we also started to notice that she wasn't participating in as many community events, and like she wasn't going to visit her friend Emmy very much anymore,
Hmm.
and she wasn't inviting people into her home much anymore. We started to really kind of see some isolating behaviors with her. um, Communication is also another area where we started to see some real decline. It was really interesting. One of the things that she did to kind of compensate or mask some of this stuff was her hearing got really bad, except her hearing didn't get bad.
Ah,
So it was right. It was, oh, can you repeat that? I didn't quite get that. I'm having a hard time hearing. But when we noticed, okay, well, maybe we need to take her to the doctor and get her hearing checked, her hearing was fine.
hmm.
And so we
Yeah.
started to understand that she wasn't having a hearing problem, she was having an understanding problem.
Right, right. And just trying
Right?
to buy more time in the conversation to process.
Exactly, to process, exactly. And so those are some things that we definitely picked up on and started to clue us in on. We need to kind of give her some more support and help in that area. So social issues and then changes in communication. And I already mentioned the fact that she got a little bit agitated easier.
Hmm.
And so we saw that in conversations as well. There were many times that I can remember her like just shutting conversations down. Like, okay, we're
Oh,
not talking about that anymore and moving on. So yeah.
yeah. Oh man. Okay. So for our listeners out there who are hearing this story and like, man, Nicole, what's happened to your grandmother? I think it's happening to mine.
Mm,
I want to move into, okay, we've identified it. Now what do we do? So fortunately, you do not have to do this alone. There is tons of help and support and resources, both with making decisions, facilitating the conversation, and and the type of help that your loved one needs. So I just want to cover a few of those things. So first and foremost, this is one of the arenas where having an independent patient advocate can be particularly useful. They can help your aging loved one attend medical appointments and understand what the doctor is saying. Remember that the appointment is happening in the first place so that we don't have to go to the dentist 4 times and also pay the late fees associated with that.
right?
But they also, having an advocate like myself or Nicole can be very helpful in kind of bridging this gap between parent and child. So, one thing that I've seen a lot in my
Hmm.
practice, and honestly, even in my personal life, is when you have the older family member who is typically, a generation ahead, so mom or grandma, they don't want to hear from their child about what the kid thinks mom needs to do. It's a very can be much a power struggle from the beginning, because you also have to keep in mind, like, then that person is feels like they have to admit to this cognitive or physical failure, and I mean, nobody wants that. And then to hear it from your kid, who I raised you and I changed your diapers. It's just,
Right?
it can be a very difficult conversation. But then suddenly,
Yeah.
when you have a neutral third party involved who is an expert on the topic, I can walk into the room and say the same thing that the daughter did, but now mom's going to hear it because I'm not her kid and I, have the credentials and I'm the professional. So it can be very helpful just in that way of getting your concerns heard by your loved one from a like non-judgmental perspective. And then also for the practical aspects of figuring out a medication management system, and again making sure they get to their appointments and that the things that the doctor is saying needs to be done, there can be some follow through, particularly if, again, you're not local to this family member. That can be challenging to try to navigate from afar.
Pam, I can't help but I just want to share that I've actually had family members that have called me and reached out to me. And during our complimentary call, they, are telling me what's going on, and I'm confirming and validating, yes, you're on the right track with mom or dad, and this is right, this is good. I've actually had children say to me, can we do a strategy call where it's you and I and my mom so that she can hear
Mm-hmm.
you deliver this message? And of course, obviously, that's something that we're here to do. And it just
Sure.
kind of brings out this point of what you're saying, right? And I honestly, I'm an adult, I'm a parent of adult children. And so as we're having this conversation, I'm only hoping that when this is time for me, I can hear these messages from them, right? Like, because I understand, right? And I'm hoping that my understanding will translate into, practical understanding.
Yeah.
However, I also understand that that dynamic, parent and child, is just a dynamic that sometimes needs to be navigated, and
It's a strong
sometimes bringing
dynamic.
in, yes, yes. So sometimes bringing in a third person just for a conversation can be
Hmm.
helpful.
Yes, and if you're in that position, guys, this is something we can help you with. Please reach out. How to sh, just like in the top of the corner.com, and you can get connected with us. And I just, to that note, Nicole, the dynamic is strong because let me tell you, my mom and I are working together to try to manage my grandmother's health from afar. We all live in different states, so that's hard. My mom leans on me because, I've got the background. She is not a medical
Right?
person. My grandmother has complex medical issues. And my mom is constantly sharing with me how frustrating it can be for her to try to get my grandmother to hear and to listen. And my grandmother does the same thing to me. She likes to remind me she was the first person who held me when I was born. And I think, she still sees me in that perspective, and she's really not aware of how I've spent my career. She doesn't watch the podcast. She's not familiar with the type of experience and expertise really that I bring to the table. But my mom recognizes it because I've been able to help her so much with this journey. Yet when my mom had a health issue a couple years ago, the pushback I went through with her.
Right?
So
It's
all of that to say
yeah,
that even the woman who
yeah,
recognizes the skill set, when it got into that dynamic with her and me, she started to lean right that direction of,
yes.
I'm the mom.
I'm the mom. I'm the mom. I'm the mom. I said,
Yeah.
I'm sitting here like, okay, help me. Help me be able to hear this from my kids because it is a strong dynamic. And I think the real message in that is that it is universal. Like
Yeah, it's
this
not just you.
right? It's not just you. It is all of us. And we talk about it a lot. I see the day where Kayla and I've had a conversation around when it comes time, I'm gonna and need an advocate to help broker these conversations with my family, my parents. I'm probably gonna lean on my friend Kayla to kind of help me with that, right? Because even though we are professionals, we are also still children.
Hmm.
And it can get too complex and too complicated, even for those of us that do this regularly when we're dealing with these very intense relationships. And I think that's a really
Right.
important message.
And to that note, I've said many times before, your brain can work in one mode at a time. It can work in the rational critical thinking mode, or it can work in the emotional mode. But you can't be emotional and access rational critical thinking at the same time. That's truly why Heard for Life was born. My advocacy practice, because I went through a health situation and realized that when I was in that emotional state, despite the fact that, I know all of the things, it was so incredibly difficult to try to pull out of my emotions to get into that critical thinking, problem solving mode. And really, again, having that emotionally removed neutral third party, not to say that your advocate doesn't care, but we can care about you to the point that we are able to remain in that non heightened state to be
Yes.
able to help you with that rational critical thinking.
Right.
So as we move forward to having this conversation with our older adult loved one, Nicole, how did you initiate that conversation with your grandmother? How'd that go?
Yeah. So I probably didn't. This is where I think leaning into having a family and a tribe really can be helpful. We had a family member who had a really good practical relationship with my grandmother. It happened to be my dad, and he seemed to be the family member that could do no wrong in her world ever. And so we leveraged this relationship at this point in time, because we knew that if anyone could have a challenging conversation with her with a even moderately positive outcome, it was going to be him. Right.
Sure.
And so we leveraged that. And my dad, we talked about it as a family. And then he actually delivered and had the conversation with her. And I will tell you that it did not go well. However, it went as well as it was ever going to go. Right.
Right.
And so, he had the conversation. She didn't like it. It was hard and it was challenging. However, because for the historical relationship that she trusted him, ultimately she complied. Like that's the best that I can say is he was able to, I don't like it, but since that's what you want, I
Right.
will do it for you. Um, and so that's kind of where those conversations started. Now I have to tell you, we also got very creative in some things. Um, we did. We got very creative. I will never forget the time that we had a family barbecue at her house, and the garage was it was a safety hazard. It was really bad. And so during this family barbecue, my dad and my uncles went in and cleaned out the garage. And our job was to keep her busy and
Mhm.
distracted from the garage so that she wasn't actively seeing. She knew the conversation was there. I don't want to make it sound like it was, sneaky. The conversation, and she knew that this was going to take place, but we
Sure.
also knew that she wasn't going to necessarily remember authorizing that this was going to take place. And so the logistics of that became really important, because if she had seen it and witnessed it and not remembered the conversation, then we would have another whole issue. And so, yeah, I this is why I think that, as families, it's really important. And this is another place where advocacy and independent advocates can be helpful, right? Is coordinating and helping families come together to have these kinds of conversations and set these things up such that it will work. Because at the end of the day, I have to say, my grandmother was very happy that the garage got cleaned,
Yeah,
right?
absolutely.
So I think that leveraging relationships and honoring, because in family systems, we all have a role that we play. And if you can acknowledge and understand those roles, you can leverage those relationships as a team to really support. Like, it felt really good. It felt like we were doing good things for my grandmother. And it also felt like we were protecting her,
Yeah,
like
and that's
protecting
really
her.
what it all should and needs to come back to, is remembering and keeping in the forefront that, we want what's best for this person. And I want to say sometimes, but oftentimes they can be their own worst enemy. So you're right. We do have to get creative with understanding first the family dynamics and then how to put the right people in the right places. And when we are having these conversations, we want to make sure that first and foremost that we are coming from a place of empathy and really making that the forefront of how we're speaking to this person. We definitely want to stay away from anything judgmental. So, for example, using specific observations can be better than kind of generalized statements. For instance, it sounds the person's going to be a lot more receptive to hear, hey, it looks like you're struggling with those stairs, as opposed to, you're getting too old for this. So trying to again bring it back to a place where, we're taking the emotion out of the situation and you can just clearly share what you're seeing. That can help to disarm the immediate defensiveness that our loved one is inclined to have.
Right.
Also, as much as possible, I do encourage you to ask for the loved one's input and opinions on things, because the
Mm,
last thing we want is for them to feel like all of this is just happening to them, and to feel like their thoughts, feelings, and input is invalid. Nicole, how were you able to
Yeah.
kind of work that angle in with your grandmother?
I think this is super important. I mean, I can't, when we think about how we work with other people, this is an area where I think it's easy to get caught up in the what needs to happen, what should happen, all of the things. And it's easy to focus so much on that and forget, right? Forget that we're dealing with people, individuals who have worked their entire life to be independent and to have some say so in their life. And so I think this point is huge. Like I said, cleaning the garage was a conversation that was had with my grandmother, and she was super excited to get it done. Right. And she wanted the boys to do it. And we had this conversation with, wow, wouldn't it be nice if you could go out there and actually utilize the laundry room in the garage again? And oh, yeah, that would be great. I would love it. To complete and total buy-in. But remember, in the moment she had buy-in, but when it came time to actually executing the plan that she had buy-in, we knew that there wasn't going to be a connection with that. And so that's where the creativity comes in. Because once it was done, and the day we were at the end of the day, and we were like, hey, grandma, guess what the guys have been doing all day while we've been hanging out doing all this stuff? They were cleaning your garage. Come take a look at your
Right.
laundry room and how you can, right? And so it pulled that all back in. And I think that the truth is, Kayla, if somebody came to me today and said, Nicole, you need to rearrange your kitchen because it's not safe the way that you have it right now, there'd be a fight. Like, it's just that simple. And I'm completely like, there's no safety risk for me today aging in place, right? But still I would feel defensive about that. And that is our human nature. And
Mhm.
so we've got to be aware of that and respectful and honoring as we navigate protecting our aging loved ones. And I think it's stress that kind of tips us over into just wanting to get it done. um, but taking the
Oh
extra time
yeah.
to get
And
the
I mean, and
buy-in.
it comes from, you have the best intentions, and you just want
Right.
to make sure that they're safe, and that, they don't have falls, and that they don't eat spoiled food, and they don't miss their medications, or God forbid double up on them. So it all
Right.
comes from a place of wanting what's best, but to get it to be received that way can be challenging. Another thing that comes to mind for me, just to add on to this point, is presenting choice where someone has it and not where they don't. So, what do I mean by this? For instance, as you're moving through the process with cleaning out the garage, you're not going to keep asking grandma if she wants to clean out the garage. But perhaps when some things come up that, grandma really wants to keep, it can be, do you want to put it out in the living room, or should we pack it in the attic? Like those kind of simple choices to keep that person involved, engaged, in control with making decisions, but maybe not all of the big overarching decisions, especially once they've been made.
Yeah. Right. We saw this specifically when it came to when the choice had to be made that she couldn't live alone anymore.
Mm-hmm.
Right? We had these conversations around, do you prefer to move closer to your son, Ron, or do you prefer to stay closer to your daughter, Barbie?
Right.
Right? Not like it was, which one of these two do you prefer? Not saying, staying at home. Anyway, that's a whole nother layer of
Yeah,
conversation. But when you talk about choices, that's kind of, that's the immediate conversation that came to my mind with grandma was that,
exactly. Exactly.
you know, where
So,
she could be
Nicole,
located.
yeah. So, for somebody who has seen these signs and is going to start having these conversations, can you give us some recommendations for resources for how they can start to figure out either getting help in the home or placement options, and
Yeah.
who pays for all of that?
Yeah. So, first and foremost, I always suggest that when you start to see this and you're looking at planning, the first place to go is to your local area agency on aging. And every county in the US has one. So, this is a place where you can go and get access to local resources. Okay, so those are going to be specific to your community. They're going to be really local. The reason I say this is because I think that looking at resources regarding like getting a safety assessment of the home, again, a third party that can kind of come in and help with where these physical hazards might be is a really good place to start. It'll also give you access to local home health agencies that have services that could come out and do these types of things. I ran a private duty out of Nashville, and that was one of the regular things that we did was have a nurse go out and do a safety assessment of the home. So looking at those types of things, you can obviously independent patient advocates, you can look at assisted living facilities. There's also continuing care retirement communities that have multiple layers of services available all in one community. So you can start to access and figure out what's available so that as things happen and progress, you understand what options are out there. I think it's important to also put some financial planning things in
Ooh,
place and look at
absolutely.
considering. Right. And so, specifically in regards to that, there's a couple of things. One, I want to make sure that everybody understands that Medicare's payment options and benefits for long term care are very, 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 very limited. Okay. So, this is not going to be someplace where you get a lot of support in the home, so you're going to have to like look at other options. Now, I will say that Medicaid in the state sense does have extended benefits to help people age in place. The problem with this is that it is a financially based benefit. So, that having been said, I suggest that everybody look at estate planners who
Hmm.
specialize with Medicaid planning so that for financially going forward, you have in place a financial plan that will also support your aging in place plan. Um, and for those reasons, earlier is better. Just so everybody knows that there is a 5-year look back for Medicaid, which there's a whole implications, and we could probably do another
And
whole
there
conversation.
is another episode that goes deeper into these things. But to really kind of cut to the chase and sum it down, Medicare is not going to pay for the nursing home or the assisted living. It's often an out of pocket expense until you can qualify for Medicaid, which involves paying for everything out of pocket and spending all of your retirement funds. Now, working with estate planning, you can shelter a lot of those monies. There's a lot of strategies they can do. And the sooner you do it, ideally more than 5 years before care is needed, the
Yes.
more of your hard earned retirement money can be kept. You also have the option of long term care policies that can help to
Hmm.
cover the cost of long term care. However, those are policies that, just like life insurance, if you're trying to buy it when you're already 70 or 80, it's probably the dollars aren't going to make sense for you. So that is something to keep in mind much earlier, but still worth mentioning. Some people's life insurance policies, though, do have a long term care rider. So if you are looking at care replacement options kind of imminently, it's worth calling the life insurance policy and seeing if that's something you can access.
Great points, Kayla. Yes, all of that.
And lastly, there are options to help with finding the right in home care providers or the right facilities to place your loved one in if that's if they're having kind of cognitive, mental, physical, and household difficulties, it may not make sense for them to stay in the home anymore. And we may need to look at facilities. I mentioned earlier the company Care Patrol. They are locally owned and operated. So every area, it's going to be a little bit different, but the one that in my area is phenomenal. Her name is Amy. When Amy opened her franchise 10 years ago, she literally went to every single facility in the area and toured it and took notes, and she continues to stay on top of it. And she pulls the records, the abuse reportings, like everything you could ever want to know about every facility in the areas. And they are a free to use service. They get paid on a referral fee when somebody does get placed. So that can be a very valuable resource as well for people trying to navigate where to send mom. Don't call a place for mom.
Right.
Yeah, that could be another episode in itself too. But don't call them. Call Care Patrol.
That's right. Yeah.
So this was a lot of information. I hope this was really helpful. Please enjoy your Thanksgiving, and I hope that you show up to your loved one's home and see none of these things. But if you do see them, now you know what to do. Please don't hesitate to reach out. Again, it's how2sh.com, and you can get in touch with me or Nicole, and we can get things figured out for you, get you in the right direction.
Love it.
All right. Thanks for chatting with me, Nicole.
Yeah, thanks for letting me hang out. Good stuff.
Yeah. And we will see you guys next week. Bye-bye.